Hey everybody, Dr. Langston here. Today we're going to talk a little bit about pregnancy-related back pain. There was a great study that came out a few years ago. It was a conjunction study with Washington University, Barnes-Jewish, and Logan College Chiropractic called the MOMS Protocol. And it works on exercises and preventative things for women who have back pain during pregnancy. We've read it, we've worked on it, we've researched it, we've even done some training with it. It's a great, fantastic, multimodal research study that talks about how we can help women with back pain. One of the biggest things is prevention. Things you can do in trimester 1, trimester 2, trimester 3 that can actually help you to not have pain. Some interesting studies or statistics are 40% of women who have back pain during pregnancy will have it up to 6 months after they have their baby, and another 20% can have it for up to 3 years after they have their baby. And that doesn't even include other issues like whenever somebody gets an epidural or other parts or other issues if they had to have a C-section. Those are other parts that can make it even more of an issue for back pain. So I'm going to show you something today. There are 3 little simple exercises that can be done at home. They're really great. If they're good for you and they help your back pain, awesome. If they don't, we have some other protocols we do in the office here that are part of that MOMS protocol that are really great. So first exercise, we call it the cat camel or cat cow. You've probably seen it somewhere before. We're just going to talk about it again. So I'm going to get on my hands and knees, the quadruped position we call it. I'm going to let my stomach just sink all the way to the floor. And I'm going to arch all the way back up. I'm going to sink all the way to the floor, all the way back up, all the way down, and all the way up. So that's a really simple kind of phase 1 exercise. We'd start you off with 1 set of 10 twice a day, and then we kind of continue to bump it up to maybe get up to about 2 or 3 sets of 10, 1 to 2 times a day. Second thing we're going to do is what's called the bird dog. You may have seen this one again. We're just going to talk about it. One of the key parts to the bird dog exercise, I want to keep my head nice and long, right? I'm not letting my head come down. I'm not looking up. I'm keeping my head in a nice long, it's almost like somebody's pulling on the top of my head, trying to make my neck long. And what I'm going to do, I'm going to bring my left leg out, right arm out, left arm out, right arm out, and back. One of the things I don't want to do is I don't want to have to really rotate my pelvis. That's going to really put a lot of pressure on the back. It's going to break that stability system. One of the things we tell people is like, if I want to kind of almost get punched in the gut, I want to really tighten up, stabilize, and come back down. If that's too difficult for you, you can peel it back. You go just a leg, and again, I'm trying to keep my pelvis from shifting, or I can go just an arm. Again, just trying to keep everything from shifting side to side. Fantastic exercise. Just like our cat camel, we'll start off with 1 set of 10 twice a day. We'll kind of bump it up as we feel comfortable, go up to about 2 or 3 sets, 1 to 2 times a day. Last thing we're doing is what we call the clamshell exercise. A lot of you have probably seen this one before. Again, just a really great exercise. I can keep myself stable on my arm. I can come down like this if I want. I'm going to keep my foot on the floor. I'm just going to raise my knee up and come back down. Raise my knee up, come back down. I don't want my pelvis to shift or rock. Even if in the beginning, this is as far as I can go, that's okay. I'd rather have short range of motion than try to rock my pelvis back. If this is pretty easy for you, you can also put a band around your legs and raise up to a little bit more resistance. With this one, I would go ahead and start you off with 3 sets of 10, just once a day on both sides. Those are 3 really simple, great exercises that you can do at home, even from the moment you find out that you're pregnant, just to kind of prevent any further back pain as the body shifts. If that's good, awesome. If that back pain comes out and it's like, it's not getting any better, we have tons of safe protocols for mom and for baby that really help. So if you guys are needing anything, give us a call.